Hello everyone. A couple of disparate topics today. So talking about possible glutathione allergy and then also the difference between DNRS and neurofeedback. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So I posted a video a little while ago. How long ago was it? Let's see here. 2 weeks ago about topical glutathione cream, and somebody posted a question saying, can people be allergic to glutathione? I have taken it a few times, and every time I do, I have terrible panic attacks and feel very sick. Could that be mold die-off, or am I having a reaction to glutathione? Same thing happens when I take NAC, which is N-acetylcysteine, which is a component of glutathione. It's kind of one of the rate-limiting, what is the rate-limiting substrate for glutathione synthesis in the body. So thank you for the question. So I mean, to kind of give the cheeky answer, a person can't technically be allergic to glutathione because then you'd be allergic to this, innate component of your own biochemistry. We all synthesize glutathione every minute of every day. So I don't believe it's possible to actually be allergic to glutathione itself. If a person was having a more traditional allergic type reaction, like say, having itchiness or hives or, runny nose or something like that, then it would be more likely that it would be a reaction to one of the non-medicinal components with the glutathione. So say if it was a liposomal glutathione preparation, it might be a reaction to the soy or the sunflower lecithin that's wrapping around the glutathione molecule, or the sweetener that's in there, or something like that. In terms of having that type of a reaction, panic attacks and my little battery dying indicators coming up here on my laptop. Let's see, so terrible panic attacks and feeling very sick. That in my experience, when my patients have those types of reactions to anything really, but seeing that with glutathione sometimes, not so much with the panic attacks. That's a less common thing to see, but I've seen that with other supplements over the course of time. I would say that it's very likely not an allergy, but more like when I've seen that in my own patients, it's very likely not an allergy. It's more of a physiological downstream reaction to, as you've suggested here in the question, a mold detox reaction, or might be detoxifying something else. Could be clearing heavy metals or other chemical toxins from the body or whatnot. So I'd be suspecting it's more something like that, as opposed to being a frank allergy to glutathione, if I were to see the exact same thing in one of my own patients. What is interesting when folks are having panic attacks, or anxiety, or just feeling like really kind of like revved up, as I've seen from in other patients before. I mean, maybe I've seen that with glutathione. I'm not 100% sure off the top of my head. Too many patients. It's been a long day, but I think that it's. I don't think I've seen that with glutathione specifically. But when there is that type of a reaction happening, I mean, sometimes it's because the substance that a person's taking can sometimes get converted into a neuroinflammatory byproduct. So for example, when folks take supplements or medications to boost up serotonin, and they have kind of this paradoxical reaction, they feel more anxious, or more they have panic attacks or something like that. Well, serotonin, as part of its breakdown pathways, it can get turned into something called quinolinic acid, and if that quinolinic acid builds up, well, it's a neurotoxin. It's an excitatory neurotoxin, so that makes sense. Or when people take GABA and have this paradoxical reaction, well, GABA interconverts into glutamate, and glutamate's this excitatory neurotransmitter, so that makes sense. When it's something like glutathione, if that's causing panic attacks, in my experience, or well, sorry, I haven't seen that specifically, I don't think, but my rationale, I should say, would be, if I saw that in one of my patients, I'd be thinking like, it's probably that it's detoxing something a little too aggressively in the brain, and then that's driving this neuroinflammatory process, and then that's driving the panic attack. So anyways, don't think that a glutathione allergy is possible. But that's my thoughts on that topic. So thank you for the question. If there's further questions that you have about this, or any clarification based on what I just said, feel free to post in the comment section below. On the same video, there's a question about DNRS and neurofeedback, and I thought, hey, I'll just do a 2-for-1 here and answer both questions. So the question is, does DNRS, which is an acronym for Dynamic Neural Restructuring System, I believe, and a neurofeedback therapy, do the same thing? So it's a good question. So DNRS is in the realm of what they call amygdala dysfunction, or well, it's start again. There's this condition called, or this issue that many folks suffer with, called amygdala dysfunction, and there's amygdala retraining protocols or programs that are out there, and DNRS is one of them. The other one, the other best known one, is what's called the Gupta program. And so DNRS basically is a series of exercises that a person can do that, for all intents and purposes, have to do with sort of how can I describe this succinctly? Basically, it's a combination of cognitive behavioral therapy, neurolinguistic programming or reprogramming rather, and kind of guided visualization. And it's sort of those three therapies with some other sprinklings of other therapies kind of in there, kind of all sort of rolled into one in a way. And it's a great system. I've recommended it for many patients over the years. It can be really, really helpful. And so it kind of combines those systems to basically help retrain the amygdala to essentially kind of get out of this like overreacting, everything is dangerous mode. So when people have amygdala dysfunction, they can react to, every food that they eat, or every food but 3 foods or something like that, or they'll react to every supplement or medication that they take, or they'll have these overblown like intense reactions to chemicals or histamine or things like that. And in some cases those reactions are just true blue physiological reactions. The person's just full of histamine, major mast cell activation, it's they're stewing in mycotoxins or something like that, driving this MCAS issue, and they have these true blue genuine physiological reactions. In some other cases there's this amygdala dysfunction that's playing in the background, and it's a broader topic than I'll get into in the video here, but basically there's kind of this, it can be related to physical trauma, mental, emotional trauma. It can be related to excess neuroinflammation in the brain from some of those true blue kind of organic causes like mold mycotoxins or Lyme in the brain or different things like that. But essentially the amygdala can kind of get its wires crossed, and then it starts becoming overreactive to things. So it's still very much this physiological phenomenon. It's not like it's psychosomatic or all in your head. It's still a very physical phenomenon that's happening, but it's not related to like, oh, you're actually you eat the food and you're stewing in all this histamine. It's more that the body has this overblown reaction to something that is being driven by the amygdala. So amygdala retraining, like DNRS, is a specific methodology to help rehabilitate the amygdala, get it out of that like hyper-vigilant, overzealous, overreacting mode, back to just a healthy, balanced mode. So that's what DNRS does. With neurofeedback can, neurofeedback works to help balance brainwave and rebalance brainwave imbalances that are leading to anxiety, depression, possibly overreacting to foods or supplements or things like that. Can be helpful for memory enhancement, can be helpful for treating chronic pain. There's helpful for multiple sclerosis symptoms or dementia symptoms or recovering from concussions. There's lots of different clinical applications of neurofeedback, but neurofeedback's working in a very targeted way, rebalance brainwaves that are out of balance. So as I'm describing both of these, you can hopefully see that there is an overlap between them. And so if a person has amygdala dysfunction, but they don't know they have amygdala dysfunction, nobody diagnoses them with that, and then they wind up doing neurofeedback, it might really, really help with their amygdala dysfunction. Or if a person has brainwave imbalances related to, post-concussion syndrome, or because of, life events that happen that led them to develop anxiety or panic attacks or things like that, and they just so happen to start doing amygdala retraining, it could be helpful. But they're really kind of targeting things they're sort of targeting different things. So it's kind of like the best tool for the job is, or I should say, they're both different tools, and you kind of want to know, well, which jobs are they the best at working with. So if a person has just like major amygdala dysfunction, DNRS is probably going to be the best, most accurate, or most targeted way of getting things on track. Neurofeedback would probably help, but it might be a lot slower to get them to the same place. Whereas if a person has clearly identified brainwave imbalances after having, say, done like a QEEG brain map, well, then neurofeedback's going to be, hands down, or very likely hands down. There's exceptions to every rule, of course. In my opinion, generally be pretty much hands down it would be the most efficient to use neurofeedback to help bring those brainwaves back into balance. So I hope that helps to clarify that question. If anybody has any follow-up questions on either of these topics or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.